A very good evening to you, ladies and gentlemen. I am excited to welcome you to the 172nd BASL webinar and the 29th of the 4th webinar series, which is a series of professional, personal, and career development webinars organized by the Seminars Committee of the Bar Association of Sri Lanka for the year 2021-2022. Today's topic is on keeping your mind and body healthy. These webinars are organized by the Seminars Committee of the Bar Association, chaired by Secretary of the Bar Association, Mr. Rajiv Amrasurya, and convener, and together with convener, Assistant Secretary, Mr. Pasanda Silva, and co-conveners, Mr. Pandula Vanyarachi, Mr. Oshan Uberatna, Ms. Ann Devananda, and Ms. Nikini Mapitigama. I would also like to take this opportunity to thank the President of the Bar Association, Mrs. Alia Pires, President's Council, and other members of the Management Committee of the Bar Association for their support and guidance. Today's webinar is in collaboration with the Ceylon College of Physicians, and it is the third webinar in collaboration with them. I warmly welcome and thank the President of the Ceylon College of Physicians and other members of the Ceylon College of Physicians for their cooperation in bringing together, bringing to our membership such a valuable and informative sessions from experts in the medical field. Before we proceed, ladies and gentlemen, I wish to warmly welcome Professor Sarath Lekambasam and Dr. Harshini Rajapaksha, two medical luminaries with extensive profiles. And I must note that in the interest of time, we have shortened their profiles. First, I would like to introduce and welcome Professor Sarath Lekambasam. He possesses an MBBS from Peradeniya, MD in Colombo, FRCP in London, and a PhD. He is a fellow of the Ceylon College of Physicians, an honorary fellow of the College of Physicians South Africa, honorary fellow of the Royal Australasian College of Physicians, honorary fellow of the Royal College of Physicians and Surgeons Pakistan. And he is also an honorary fellow of Sri Lankan College of Endocrinologists. He is currently the chair professor of the Department of Medicine, Faculty of Medicine, Gaul. His main area of research is population health, osteoporosis, and disease of the elderly. He was the Dean of the Faculty of Medicine, University of Ruhuna. He was the President of Ceylon College of Physicians in 2012 and Osteoporosis Sri Lanka from 2010 to 2012. He has had many publications and has done several orations and contributed to books written on osteoporosis. Next, I would like to warmly welcome Dr. Harshini Rajapaksha. Dr. Harshini Rajapaksha possesses an MBBS from Sri Javadnapura, MD in Psychology in University of Colombo, PhD from Durham, and she is an honorary research fellow for School of Medicine and Health in University of Durham, FRCP from London 2017. She possesses a Vishad in North Indian classical music and Kathak dancing from University in India. She is also certified as a grade A performer by the SLBC. She is a specialist consultant in Liaison Psychiatry, Professional Psychiatry Unit, Teaching Hospital, Karapitiya, Gaul. She is the former head of department and senior lecturer in psychiatry, Department of Psychiatry in the University of Ruhuna, Sri Lanka. Presently, she's training postgraduate trainees from Sri Lanka, elective trainees from Duke University, USA, in consultation in liaison psychiatry. She has many publications in peer review and journals, and has many research. She has done several programs in promoting medical and humanities and music among medical community. I also warmly welcome my friend and moderator for the day, Dr. Lushanti Kannangara. She possesses an MBBS from Colombo, MD Colombo, MRCP UK, MRCP London, MRCP Geriatrics, diploma in writership and communication from USJP. She is currently a consultant physician at the teaching hospital in Karapitiya. So that is our panel today, ladies and gentlemen. Before I hand over the session to Dr. Lushanti, I'd like to remind you to send in your questions through the Q&A chat box. Professor Lekambasam will first do his session, and any questions that you may have to him will be posed right after his lecture. And thereafter, Dr. Rajapaksha will take. I would now like to hand over the session to Dr. Lushanti.
Thank you very much for the kind words of introduction, Anne. On behalf of Ceylon College of Physicians, I would like to thank members of Bar Association Sri Lanka and coordinators of the webinar series for inviting us again for your successful webinar series. As Ms. Anne mentioned, you can send your questions while we are having the lecture, because we will be discussing your questions at the end of each lecture. So without taking much time, I would like to invite our first speaker for today, Professor Sarath Lekambasam, Professor of Medicine, Faculty of Medicine, University of Ruhuna, and he is also a past President, Ceylon College of Physicians. He will be talking on osteoporosis. Over to you, sir, Professor Sarath Lekambasam.
All right. Thank you very much for the very, very kind introductions. And then I will, because of the interest of time, I will speak for about, let's say, 15 to 20 minutes, and then leaving another, let's say, healthy 10 to 15 minutes for the discussion afterwards. I'm sure there will be many questions on this field of osteoporosis. First of all, just to say that osteoporosis is not something new, it's not something that the modern generation of doctors has invented and then trying to force on patients. And then you can say that even in 1940s, in that the word of osteoporosis was used in the literature. So just to say that, I don't want you to read through this, but then just to say that, this is not something new, this is something pretty old. And Albright is the one who has done that first. Both of the last two publications is the one who has done substantial work on osteoporosis. And then for a long time, it was known as Albright's disease. But then later, the word osteoporosis was coined and as a more acceptable term. I just not resist my temptation to show this bit of information to the audience. This I gathered some time ago that from the internet, that is the fossil remains of the 28,000-year-old mankind from Sri Lanka. And then excavations were done by well-known figures in Sri Lanka, Siran Dharniyagala, I'm sure you all know about him. And then the description of the bone was quite interesting. And they said that the cortical bone, again, a lot of technical jargon is coming here. But then I want you to concentrate on the last word, what is called they said that the bone was porotic. The porotic means that bone has many holes, that means many gaps. Now you say when you see a bone and you feel that bone is filled with cement. Cement means, I'm literally saying cement is the material inside the bone. But then this particular situation that the bone had many holes within that, and then you say it's a porotic. So this is very much like osteoporosis. I'm in no way saying that the fossil, our 28-year-old ancestor had osteoporosis, but this particular information was quite interesting. Let's say we'll start from the very beginning, since I'm speaking to a sort of, non-medical community. Let's say if you woke up with a little chest pain in the morning and you wonder whether you are getting, you have got a high cholesterol and whether you are going to get a heart attack. Then the course of action would be quite simple. You visit a doctor and get a lipid profile done. And then the equipment you need for that is a lab analyzer that each and every sort of, a lab should have that. Let's say you woke up with a little headache in the morning and then you thought that you've got a high blood pressure and you're coming for a stroke. And then again, the answer is quite simple. You visit a general practitioner, get your blood pressure checked, and then he should have a blood pressure apparatus which is widely available. Let's say that now in this situation, let's say you got a backache and you wonder whether you got osteoporosis and you're worried about a fracture. Now, things get a little complicated here because, like not like lipid profile or blood pressure. We are talking about a little more complicated yardstick, which is used to measure osteoporosis. What's called bone mineral density. Now, I want you to know this and then forget about it because it's a little technical term that we use. But again, I'll just, because cannot complete an lecture on osteoporosis without introducing that term. Now, get a little more complicated because it's not like a blood pressure apparatus or lab analyzer. You need a special equipment called Dexa machine. I'm sure some of you all must have heard about that. Only certain cities in Sri Lanka still has a Dexa machines installed in those cities. So it will get complicated because the machine that is used to diagnose osteoporosis is not widely available, and also the measurement that is taken is not familiar even for some of the doctors. In Galle, of course, we take the pride saying that the first Dexa machine, first ever Dexa machine in Sri Lanka was installed in Galle, and with a very generous contribution from Dr. Minister at that time, High Education, and he gave a very generous donation, Richard Paterna, and then with that, I was able to install the first Dexa machine in Sri Lanka in Galle. Now, this is what the Dexa machine looks like. It is a kind of, like a CT machine, but I'm not going to go to the details of that. The bone mineral density is the density of the bone. If you say like any substance, the substance has a density. So density determines the strength of the bone, how strong it is, and also the tendency to break or develop fracture. So that is what we are interested in. Now, when you look at the bone density throughout the life cycle, you can see that here at the very beginning, your bone mineral density increases quite exponentially during your, let's say, in childhood and also during your adolescence, and then come to a peak. Now, these two lines, one for men and one for women, and then men stays about higher, have a higher bone mineral density than women, and then that is true right throughout their lifestyle, during the lifespan. So the bone mineral density come to a, let's say, a peak level at some point, and then not much of change afterwards. And then with the menopause, I'm sure you know that the cessation of the menstruation in female, and then the bone mineral density start declining quite rapidly. And then, but then you can see that in men, it doesn't happen like that. There's no significant drop. There's no significant drop of bone mineral density at that point, but it declines, but not as much as in female. So what happens is that the female enter into what is called this red zone, which call it fracture zone, so much earlier than men. So women at the age of, let's say, 60 and 70 enter into this fracture zone because their bone mineral density, the density of the bone, become quite low. Now, this is a teacher and who volunteered her photographs to the International Osteoporosis Foundation, and that is where you can see that when she had like 20s, how pretty she was. But then, let's say about 40 years later, and then she got multiple fractures, and then as a result of that, she got completely disfigured as a result of fractures. So she suffered multiple fractures, particularly in the spine, in the back. And as a result, she developed a little hump in the back and little bent forward, and then she became quite disabled. So you can see that it's a particular disease of women, and this is what I want to highlight with this slide. Now, this is the structure of a normal bone, and everybody must be pretty proud to have something like that in the let's say in the skeleton, because it's quite strong and you can't break it really. Now, when you develop osteoporosis, you can see how bad it is. And then the connections, what are called the vertical and the horizontal connections, are lost. And then bone becomes quite brittle. And you can see that you can really certainly crumble this, and then quite unstable structure of this bone, and quite sort of dangerous to have that kind of bone. And now the bone get decayed or bone get destroyed because of this particular cell. And this cell called osteoclast, and then what happens is it dig a hole, and this electron microscopic appearance of this particular cell called osteoclast, and what it does is it actually dig a hole in the bone, and then you can see that cavity. You can see that cavity, dug by this osteoclast, and then you can see the small fracture developing within in this particular bone. Now we got a little balance mechanism. The body is not without a balance. Always that the biological there's a balance between the systems, and this is chapter it's called osteoblast. And the osteoblast, the job of the osteoblast is to lay down new bone. So as osteoclasts come and eat up the bone, and the osteoblasts move into the area, and then it filled up with a new cement in that area, and you get a brand new bone. This is actually quite complicated process, and I don't want to spend a lot of time on this. Now, I'll take this opportunity to describe what is called the treatment for osteoporosis at this point, because it's much easier to understand here. So a decent drug given for the osteoporosis should either knock off this cell or inhibit this cell, because then it will not actually destroy the bone, or at least promote the action of this bone. So largely the treatment used in osteoporosis are divided into two groups. Either they inhibit the osteoclast so that bone won't get eroded, or they enhance the action of osteoblast so that it is easy for osteoblasts to lay down new bone. So this is how actually the osteoporotic drugs are generally classified, and there are drugs, of course, with a mixed action, and they have action on the osteoclast and also on osteoblast. Osteoporosis is not an uncommon disease, and there are about 200 million women affected worldwide osteoporosis. And then if you turn to little Sri Lankan data, that the studies that we have done and published in literature, we said nearly about 50% of women over the age of 50 years are likely to have osteoporosis. That's Sri Lankan figures. And also we said that about 5 to 6% of men over the 50 years also like to have osteoporosis. So you can see that it's predominantly a disease of women. But then the men can't be sitting pretty here saying that, well, it's a disease of women. We know that in women during their lifestyle, like, let's say after the age of 50, 1 in 2 women are likely to develop a fracture. And certain literature said there's 1 in 3, but then generally agreed with 1 in 2. So let's say if you got about, let's say 100 people, and after the age of 50, and you can see that at least 50% 50 people will likely to have fracture, but is much less in men, and that is 1 in 5 men, so about 20% of them. Now, the site which are commonly affected with osteoporosis and the fracture, the predominant one is what is called the most sinister one is the hip fracture. So you are fracturing your hip bone, and then you're unable to walk with that. And the second one is what's called vertebral fracture, fracture in the spine. So that is the second most sinister fracture. And then the third one comes what is called the wrist fracture. You are fracturing your wrist, and then generally these people end up with either the Ayurvedic doctor or some of them come to the hospital. So these are the common sites, but there are many other sites, at least about half a dozen sites in the body where you can get osteoporotic fracture, but they are few and far between. But the common ones are either hip, vertebrae, or the wrist. Now, these are the hip fracture projections for Sri Lanka. I'm not again going to go to the details of this one. Again, we published some time ago. And then we found that this is what the hip fractures going to be in Sri Lanka in future. So there seems to be a steady rise of hip fracture incidents in Sri Lanka. But it's not in Sri Lanka, in all over the world. You can see that this kind of trend, and that's mainly because of the aging of the population. So our population is aging rapidly, and you will find more and more older people in the population, and then get more and more hip fractures in the future. Right. Now, if you did visit a doctor and then had a Dexa scan done, and then he will hand over you the report, something like the report of this nature. And I'm not going to go to the details of this one, and you are like to get a report of this nature. And then this is about the again part of the report. Now, the diagnosis of osteoporosis is very much a technical thing. And then this is dependent on the amount of bone mineral density that you have got in your body. And then based on certain calculations, and certain people say they got osteoporosis or not, again, something that we don't have to go to the details. It's very much like, we are going to somebody with a blood sugar and the doctor says, well, this is a cutoff point, and about whether you got diabetes or you don't have diabetes based on a value. So same thing applied in osteoporosis as well. Now, who should get a Dexa scan? And then this is quite there's agreement among all the, let's say, a major professional organization. These are the people that he should have Dexa scan, not each and everybody. Women over the age of more than 65 years or more should get Dexa scan, and regardless of their symptoms, whether they have a backache or not, it's recommended that women over 65 years to get a Dexa scan. But if a woman younger than 65 years to get a Dexa scan, and there should be a minimum of one risk factor, and that is how to have a disease, or they should be on medication which promote osteoporosis, or patient has had a previous fracture, or there's a family history of fracture, and etc. So just that, people, let's say a 45-year-old woman who is completely asymptomatic, who does not have any of these things that, given in the bullets, and that does not really qualify for a Dexa scan. So this is one of the problems that we have got in the country. When you come to men, we have given a little higher value for the age. So that is 75 years. Again, things are which are sort of common, and then, but we are given different age for that. Now, controversy one. Now, detecting low bone density in people outside these categories is really meaningless. Now, this is one of the scenario that I had to face. A 34-year-old woman visiting a supermarket in Colombo and was invited by a group of people to come and get a bone density. And then she got her bone mineral density tested, and then found that the bone mineral density to be low, and then asked to see a doctor. And then she made a little bit of circle among the doctors, and finally ended up with me. And I said that, you can completely forget about it, and you don't have to get a Dexa scan because you do not qualify for a Dexa scan. Because a certain percentage of people, since we are taking a little technical point, to diagnose osteoporosis, and certain people can have low bone mineral density, and that should never be considered abnormal. So this was a completely unnecessary scenario created by people with a vested interest. Now, in this situation, there was no indication for the test. And the community screening is not practiced because no country has embarked on what is called community screening. That is going to the community and calling people and get a Dexa scan, because it's not very cost effective. And also, device used in this particular situation is not a device which is used to detect osteoporosis, which are little mobile, little gadget, which is not really used to detect osteoporosis. And the low bone density in this situation is not something abnormal, and something which can be a normal phenomenon. Now, the second situation is that who should be treated? Now, the controversy too. Should everybody with osteoporosis be treated with a specific drugs which are costly and with a lot of side effects, or should only a certain people with high fracture risk be treated? So let's say if you went to a doctor with a high cholesterol level, and before doctor write a prescription for, let's say, a lipid lowering drugs can lower the cholesterol, and doctor will like to get a little more information about you, whether you have diabetes, whether you are smoking, whether you had a family history, whether you have a family history of heart attack. And then with that, he gets to get a calculate mentally what is called your risk of getting a heart attack. Now, two patients with the same cholesterol level can visit a doctor, and one person can walk away with the specific drug, lipid lowering drug, so the person get on little advices. That's because we are working on what is called the risk of getting a certain diseases, not only just me on the cholesterol level. Similar thing here. And people should not be treated just because they have got osteoporosis. People should be treated only when they have got a high risk of getting fracture. Now, let's say a 30-year-old man with the high cholesterol, that's something that I said I don't have to go into details again, something which I will say. Now, what are the treatment options? I told you that what I call the drugs which are used, But always we insisted what is called non-pharmacologic treatment, that is without drugs, but what else can you do? The nutrition, there should be adequate protein and calcium throughout the life. And then we have a different calcium requirements at different age groups. And then apart from that, exercise is very important, because if you did a lot of exercises, and particularly what's called weight-bearing exercises, you jump up and down on trampoline or something like that, that maximize your bone density. So you get a higher bone mineral density. In the middle age, if you did something like running or walking, and then again, bit of, weight-bearing type of, exercises, and that help to maintain your bone mineral density. So what you have gathered, you maintain. But in the old age, one who without a fracture, and certainly you can prevent bone mineral density, you prevent bone minerals at loss, and then also falls. Because if you do exercises, something like walking, you have to be careful here. You can't be jumping up and down here at this stage. If you did something like walking, and then certainly you can help keep your bone mineral density and also prevent falls. But if the patient has a fracture, and then certainly exercises should be done under the guidance of physiotherapists, and because it can be a little bit counterproductive. The most effective method is combine nutrition and exercises. That is very important. And also it's important what's called prevention of falls, because it's not like a heart attack. Let's say if you've got a high cholesterol, if you sleep on the bed, and then while you're sleeping, you can get a heart attack. The osteoporosis and fracture association is a little different, because you have to have a fall to get a fracture. So if you can prevent a fall, you can prevent a fracture. So it's very important, not like a heart attack or not like a stroke. The story of calcium, I'm sure people will be sort of, eager to ask questions on this. And then the calcium and the bone, they are highly connected. I'm sort of, wrong. It is wrong for me to say that they are not connected. They are highly connected. And if you take higher calcium intake during your childhood, you can get a higher bone mineral density. You can get a thicker bone. In the middle age, of course, there are no extra benefits. Studies have shown there are no benefits taking high calcium level in the middle age. There are some studies show that if you take high calcium level during the old age, you can slow down your bone loss. These are what's coming from studies. But then what is absolutely clear to scientists is that there's no link between calcium intake and fracture prevention. Just because you take high calcium, you can't avoid the fracture. So this much we have insisted on every time. You cannot prevent a fracture by taking high calcium, because that association has not been proven in research. Now, adequate calcium is vital for efficiency of all other drugs. And then there are many sources of calcium in Sri Lanka. And then actually I had a slide saying that, what are the cheap sources of calcium in Sri Lanka apart from milk, dairy products. But I deleted the slides. I don't have that. But remember, green leaves, a small fish eaten with bones, and then gingerly oil. And there are so many things that, that which are available in Sri Lanka, which are very high in calcium and also very high in vitamin D. So milk is not the only product. Dairy products are not the only products which have high calcium. There are plenty of other things as well. There are drugs, actually. I don't want to go into the details. There are drugs which are given by mouth, which are given weekly. There are given monthly. There are given injections which are given once a year. And so I don't want to go into the details of that. So I'll stop here. I think I've been speaking for nearly 15 to 20 minutes now. I'll stop here. I'll be very happy to take questions from here.
Thank you very much, sir, for that excellent lecture. So shall I ask a few questions? As you said that because especially the osteoporosis is very common among females, and the risk factor is especially after this menopause, there is a high risk of getting osteoporosis. Apart from menopause, what are the other risk factors for osteoporosis?
Particularly among women, are you talking about?
You can talk about both genders, men and
Okay,
women.
okay.
What are the risk factors?
Okay. Yeah, menopause remains the largest, the strongest risk factor for osteoporosis, and particularly for women. And then for men, of course, there's nothing called menopause. So it is there's a thing called male menopause. It's not actually very much well established. Then there are other things like, let's say, there are diseases, particularly there are plenty of diseases which are associated with the bone decay. There are what are called the hormone-related diseases, and there are various arthritic diseases like rheumatoid arthritis. And again, there are diseases where the calcium absorption is erratic, and as a result of that, you can get into what's called negative calcium balance very easily. So there's a plethora of diseases, and then at least a dozen of diseases, and then which are associated with this. And so there is diseases. And there are drugs that you take, particularly drugs group called prednisolone, very well known. It's a group of drugs. It's called corticosteroids. And then that group of drugs are associated with osteoporosis. Just it doesn't mean that, if you're on corticosteroid, don't stop that just because I said that. Because corticosteroid is actually a life-saving drug for many diseases. And then when the doctors are well aware that when they prescribe corticosteroid, prednisolone, that osteoporosis is a possibility, and they're always mindful about it. And apart from there are thyroxine and other drugs as well. Those are the particular ones which are strongly associated, but then there are ones which are what's called sedentary lifestyle, and where people don't do exercises, so then that is another risk factor. So those are the broadly. Smoking is the particular smoking and alcohol intake, excessive alcohol intake and smoking, and is are risk factors among men. And alcohol is particularly bad because that one way it's not good for the bones, and also they induce falls. So people tend to fall when they take alcohol. So those two together, and they increases the risk of getting a fracture very much. So those are the broad and the large sort of causes of osteoporosis.
Thank you, sir. And we have a question from our audience. What is the difference between arthritis and osteoporosis? I suppose he's asking what is the difference between osteoarthritis and osteoporosis, sir?
Yeah, there's a common question actually. Yeah. And arthritis is in a joint. It's within the joint. So let's say if you think of a joint, it is inside the joint. This is a bone. This is not a joint. So osteoporosis very much is in the bone, not in the joint. So let's say osteoporosis is a problem because of weakening of the bone, but then osteoarthritis is because of some problems happening within the bone, within the joints. I'm sorry, the joint. So those are two different diseases really. So osteoarthritis per se is due to degeneration of the degeneration means age-related changes in your body, and age-related changes in your body in what's called cartilage inside that. So usually we have got what's called cartilage inside the joint, and then with aging you get what's called wear and tear effect, like tire, like let's say a car tire, and there's a wear and tear. And then with that, you get certain changes in the joint, within the joint, and then that is called osteoarthritis, a completely different disease. They are not together here. They're completely different.
I hope you got the answer. So then you talk about this calcium supplements and this calcium and osteoporosis, the relationship. These people they used to take these calcium supplements, especially the patients with osteoporosis as well. And some people have a fear that taking extra calcium can cause heart disease, especially when they were prescribed. So they asked this question. So what do you think about this, sir? Calcium and the link with the heart attacks and the calcium?
Well, few ways that I look at the problem. First of all, you're adding unnecessary drugs into a drug regime. Let's say if you're taking about, let's say 3-4 drugs, and then you're adding another drug, and then with extra cost. And then the benefit that you get from that is very minimal, if at all, very little. Let's say if you can't take dairy products, if you're allergic to, let's say, milk, and then maybe a point that you take extra calcium as a treatment. But then when the calcium is available in the environment, you should try your best to get calcium as a natural resource rather than a drug. And then we are leaning towards the drug is very much it's become a habit of the people. So they added into calcium and the vitamin D, and they had another thing, fish oil. So their prescription become bigger and bigger and bigger, that they grow, and then as a result of this, they are really having a very marginal effect on your body and not worth the cost, the money that you pay for it. So I would rather go for what are called natural sources of calcium, and particularly, let's say we are surrounded by, fortunately, we are surrounded by ocean, and then we get plenty of fish. And the fishes, cheap varieties would be those, small fish which are eaten with their bones, and then that will be very, very good source of calcium and good source of vitamin D. So I would generally, I don't prescribe calcium for my patients, and I encourage them to take in natural way.
Right. And as you talk about vitamin D, because people tend to take even over-the-counter vitamin D supplements. Is there a place for vitamin D, and what are the natural sources that we can recommend?
Well, this need at least 2 hours webinar if you're going to answer vitamin D, the saga about vitamin D. The problem is actually, if you look at it's world over, and you can see that nearly 50% of the population have got vitamin D, low vitamin D in your body. So I'm sure that you all go to a lab tomorrow and get your vitamin D level. I'll guarantee my bottom penny, and that at least 50% of you all will have a low vitamin D level. Now this is not only in, let's say, countries like European and North American countries where the sunshine is not available right throughout the year, but in countries which are blessed with sunshine right throughout the year, 12 months a year, and even then the calcium, vitamin D levels are low. Now we have done some research and published and saying that children as well as adults are vitamin D deficient. But should all of them be treated with vitamin D is a huge question. Then of course we will be importing only vitamin D, not other things to the country. And then that's mainly because that our exposure to sunlight is very minimal. And people in countries like, let's say, Sri Lanka and Asian countries tend to avoid sun at all cost. And they get into their workplaces before sun comes out, kind of, and then they do not go out during the, let's say, lunchtime when the sun is so bright. And then again, after, let's say, 4 o'clock, they go home and they don't get enough sunshine. So this lack of exposure to sunlight causes this vitamin D deficiency, because your body can synthesize vitamin D if you have got adequate exposure. It's 20 minutes of exposure to sunlight, and the studies have shown that you can synthesize your own vitamin D. Yeah, that's the thing. So the sort of a blanket treatment of everybody with vitamin D, like occurring in certain countries, and I would not recommend that, because it doesn't sound very, very scientific. But there are people who need vitamin D, because these are the people who are having diseases which are connected with vitamin D. So I'm not saying that everybody should stop taking vitamin D. But then there are sort of blanket statements saying that you should take vitamin D in your middle age and in your old age is not really scientifically proven. Only certain people need vitamin D. But sun exposure, all of us need.
Okay, thank you very much, sir. And we have another question from a YouTube viewer. Plank exercise, is it harmful to neck by way of strain, especially during old age?
Which age do they consider old age?
Probably.
No, I would not say that, because there's one of the best exercises people can do if you know how to do it. The flank is one of the best exercises, and that get rid of your body fat, and then particular fat in the belly, and then it's a good exercise that people can do. But if you have been doing that, you should start doing that, before you become old, actually, in your middle age, and then continue. So it's a good exercise to do, and I would certainly recommend people doing that.
Okay.
And certainly I do it every day.
Thank you, sir. I hope we answered that question. And next, sir, you talk about this Dexa scan. You said that there are recommendations for Dexa scan, especially women more than 65 and with some certain risk factors if it is below 65 and for men as well.
Sure.
So how often do we have to do this DEXA scan if they found to be having osteoporosis? How often they have to do this DEXA scan? Because we usually, as you said, this for cholesterol, we said every 6 months, or for blood sugar, every 2 or 3 monthly. So as for this osteoporosis, how often do we recommend to do the DEXA scan?
Well, we do what's called a baseline, the first Dexa scan to make a diagnosis.
Yeah.
And then once you have made a diagnosis, let's say you start on a specific treatment, and let's say once a week or once a month or whatever treatment, and then you need to see the efficacy of treatment, whether that treatment works in you. For example, let's say you start on a blood pressure tablet, and then you'll be checking the blood pressure after, let's say, 1 month, and then see whether blood pressure has come down. Same with the blood sugar, same with the cholesterol. But then you can't build up the bone, you can't improve the bone density or bone quality like that, because you need at least about 1 to 2 years to see an effect. So you do a second DEXA just to see whether this particular treatment works in you. After about, let's say, 12 to 18 months, and some people stretch to 24 months. So second DEXA scan is done usually after 1 to 2 years, just to see whether the treatment works. And in generally, if people take treatment, it works. And they work actually. So generally, what is important is that people take in drugs. We found that, most of the time they take about 3 months or 4 months and they drop it. So main problem is that compliance, what's called compliance. People stick into the treatment, adhere to the treatment. But so we generally repeat it after, let's say, about 2 years. And then when we think of stopping treatment, maybe about 5 years later or 6 years later, when you think that the patient is adequately, adequate treatment period, we do another DEXA scan to see whether we can stop treatment now. So, and that is how we generally do, but we don't do it like cholesterol, blood sugar, and all that. In a year or something like that, we don't do it. One is that it's costly, and also it's generally meaningless, not very scientific if you ever do that. So 3, I would say minimum, and then some people need more than that because of various reasons, and then generally about 3.
As a screening method, if the test become negative, if the patient is not on treatment after age of 65 or 75, how often do we do if the patient is not?
Well, if you got a complete, let's say, normal test, and then let's say you are 66 years and you went and you got a Dexa scan, which is complete normal, doctor says, well, it's normal, you go after 2 years and for the repeat Dexa. So not before that really. So I had to wait for another 2 years to get a Dexa scan to see whether you have developed something in between.
And you specifically mentioned about few fractures which are actually associated with osteoporosis. So if somebody gets a fracture, do they need to do a Dexa scan? I mean, if there is a risk, as you mentioned, there are some risk factors. Apart from the risk factors, if somebody get a fracture, do they have to do a Dexa scan? Because this is going to be a question from our audience, because they will think, oh, I got a fracture, whether I have to get a Dexa scan. Is it a must?
You're asking again a question which is great controversy in the field of osteoporosis. Now, let's say if somebody got a fracture and in the old age, and then that fracture resulted from very minor trauma. Let's say you slipped in your washroom and then landed on your buttock, and then you got a fracture in your spine. That particular say that you have got a very weak bones, because no one should get a fracture by falling less than standing height or less than standing height. If you have fallen from a tree or get a knockoff by a bus or moving bus or something like that, and then you can fracture anything, that is a better rate. But again, if you have fallen from the standing height or less than that, and you develop a fracture, that's quite abnormal. So you don't have to have a Dexa scan to diagnose osteoporosis because you've got osteoporosis. But the question is that whether you need a Dexa scan for that. Certainly, doctors can trigger treatment. Doctors can trigger investigations and treatment based on that. So let's say if you're in a place where there's no Dexa facility and your mother has got a fracture, wrist fracture or the spine fracture, you don't have to run for a Dexa scan. And certainly after a couple of tests and treatment can be initiated. There's no question about it. But the studies have shown that the people who had a Dexa at the baseline, and then doctor talked to the patient saying that, look here, this is your scan, and your scan is abnormal. And then those people, the taking treatment, what's called adherence to the treatment, right, was far better than the people who did not have a scan at the beginning. So there are little advantages of taking a Dexa scan at the baseline, even if you got a fracture. But I would say that they are very, very, very tiny ones, right? But if you, let's say, if you live in a place where the Dexa, you have no access to Dexa that easily, and I don't think you should wait or you should run for a Dexa when somebody has got a fracture, a low energy fracture, and then you can certainly start treatment with that. And but let's say the scientists in osteoporosis, clinician doctors in osteoporosis, we are divided into two. Some people say don't do it, some people say do it. But then I would say that, but to start treatment, and certainly you don't have to do that. You can start treatment right away.
Okay. I have one more question. So because we talk about these treatment modalities, about these oral drugs and injections, are all these injections and oral drugs available in Sri Lanka, and are they available in the government sector?
Yes. Most of the drugs, let's say drugs which are really proven to be effective, and the drugs which are proven to be what's called cost effective. And the drugs also need to be cost effective, because the benefit that you see and then the price that you pay, there should be a match between the two. Let's say you should not try to achieve a little by paying more. That's what's called the health economics coming to the picture. You should pay, let's say, a reasonable amount to get that benefit. So drugs which are proven to be cost effective, drugs which are proven to be clinically effective, are available in government hospitals. I don't want to mention names or not, because because it's a public system. But again, those drugs are available in government hospital. There's no question about it. But certain drugs which are given for a special group of people, like and who are very few and far between, those are not available. Those are not available in the private sector. Those are not available in the government sector also, because the drugs are get added every year, like because it's a field where very fairly field where there are a lot of scientific research are being done, and the drugs get added every now and then. So, but to answer your question, those drugs are available in government hospitals.
Thank you, sir. So before we conclude this question and answer session, any specific message that you would like to emphasize? Because osteoporosis is very common, as you said, and people are not mostly aware about these treatment options and the methods, and especially the ways of getting help if they have osteoporosis, if they are how to get treatment or how to get the advices. They are not very much aware about this, because they used to come and ask several questions when they come for consultation. So if you want to give a specific message, if you want to emphasize on specific thing, can you just, before we conclude, sir, if you can talk to our audience, and if you can convey the message?
Yeah, Shanti, the message actually very simple. I can say that loud and clear. But whether people fall in line with that and whether people will do that is highly questionable, because now what you need is actually have a balanced diet, right? When you say balanced diet, when you say protein, adequate protein, a right proportion of carbohydrate and all that, there is what's called balanced diet, which most of the people don't get that, right? And if you took a balanced diet, certainly you're all right with your protein, certainly we are all right with the vitamin D, certainly you're all right with your calcium. And then the second thing is that the problem is the people attitude towards what's called the physical activity. I would not use the word exercise, because the moment you say exercise, they think that, they should get into a special garment and then, go to a gym and then do exercises. And no, that's not the physical activity. And how much physically active they are, like, they can just sit and then think about, what kind of physical activities they did for a day. And then this certainly not only for the let's say bone health, but for the general health as well, for cardiovascular disease, for the heart disease, for the stroke, diabetes, everything depend on that, what you eat and what you do. So if they can get that, that message clear, like, that they have a balanced diet in their this thing, and as a whole family, and then do enough physical exercises, and then get their muscle strength and the bone strength. Okay, I think that's what they should do, and in order to prevent heart attack, in order to prevent fracture.
Thank you very much, sir. Thank you very much.
Thank you. Thank you very much. Thanks for listening.
Thank you very much, Professor Sarath Lekambasam, Chair, Professor, Faculty of Medicine, University of Ruhuna, and he is a former President, Ceylon College of Physicians, and former Dean, Faculty of Medicine, University of Ruhuna. Thank you very much, sir, for the excellent presentation. And also we had a very good discussion on osteoporosis. I think, I hope that our listeners if they must have got a very good knowledge regarding osteoporosis, and especially about the take-home message on osteoporosis, very important message on prevention of osteoporosis. Thank you very much, sir. Again.
Thank you, Roshan. Thanks, sir. Thanks for the opportunity. Thank you.
Thank you, sir. Next, we have another important and timely lecture on stress-related problems and management of stress. And also, you also can send your questions to our Q&A box and the chat box. We can answer and discuss these questions at the end of the lecture. So our second speaker for today, Dr. Harshini Rajapaksha, Senior Lecturer in Psychiatry, Faculty of Medicine, University of Ruhuna. And she is also a consultant psychiatrist specialized in liaison psychiatry at Teaching Hospital, Karakutia. Over to you, madam.
Thank you very much for your kind words, and good evening to all of you. So today we are here to share some thoughts on stress and how it affects our lives and how to, what can we do about it basically. And I think we all experience stress in our day-to-day lives. Please tell me whether my voice is clear enough for you and whether you can see the slides. Please, can you give me a feedback?
Yes, we can hear, madam. We can hear you clearly.
Right. Thank you so much. Thank you. And they say, the lawyers, they have higher stress levels. I don't know about this. The research says like about more than 20% depression and anxiety levels, like rates all over the world. But the few lawyers I know, they are quite cool and very relaxed. So anyway, since we are here this night, just reflect and see, because we judge other people. So this is a time to judge ourselves and to see whether our stress levels, right? Are we relaxed now? Are we stressed up? In a scale of 0 to 10, where are we now? Now here, what's our level? Just take a minute to think about it. Right. So if your stress level is high, just think, what are the things that cause this stress in you? Are they events? Are they thoughts? Are they people? Whether what caused stress in you? Or demands? Right? Okay. So when we talk about stress, we have to talk about the stress response. That is why stress is medically important. So it is a reflex actually, and it was there over millions of years because it's a primitive response. And actually it helped us to survive up to now, the Homo sapiens to survive generations. Because the big dinosaurs, they all vanished. So in this book, Sapiens, it's they say, like, you know, how we came up, jumped up the food chains, right? Because we were able to free our hands and we discovered fire, right? So they say, I don't know whether this is true. The book says, like, the other animals, they had a long waiting time to go to the top, but we just jumped to the front. So these anxieties, the responses, the stress response is there with us even now, though we don't have those stressors, like the lion coming behind us, chasing us, or these things, those are not there now, but still our response to stress is still there the same way. Freeze, flight, or fight. So the stressful incidents you had today, what response you had? Whether you had fight response, flight response, or freeze response. So the stress actually is the response of both the body and the mind. And body might tell the mind, and the mind might tell the body. This response is due to the perceived stress. So we perceive something as stress, we will get a body response and a mind response. The mind will try to perceive that as a threatening thing. So our concentration, attention, focusing is there to how to tackle with this stress. And the body, you get a lot of energy into your muscles, and the heart rate goes up, and there's a big adrenaline surge. So this is acute stress, which is the reflex. But if this happens again and again, the other hormones also come into place and it will be persist. So we'll now discuss about that. Before that, now, if this is happening, right, I said we had this stress response for a long period, millions of years. So these animals also should get the bad effects like peptic ulcers, depression, anxiety, heart attacks, all these things. But the thing is, their stress is limited to this most of the time, the acute stress. Otherwise, they are not contemplating on these things. The human beings, it's a gift we have, and it's a problem at times because we can think, we can imagine things even, which is not there. So because of these things, we will have continuous stress or anticipatory anxiety, which has not happened to us, but we can anticipate. But the other animals, when they have something truly only, they will have this stress response, not otherwise. So because of this, we have the negative stress or the continuous stress, which we usually call distress, because it affects our emotions, cognitions, and our body, the physical body. So you can see in this graph how the stress and the performance relates. So as I told you all earlier, stress is not bad actually, right? That's how we survive. But when it goes up, if there is no stress, there'll be some kind of boredom, right? And they say only the dead man and the person who is not yet born is free of stress. All the others are having some kind of stress level. So the boredom, and with little bit of stress, your performance will improve. And up to a certain level, it will go up. But then there's a kind of a plateau, or we can stretch a little bit. But if you try to stretch it any more, like an elastic, it will break down. And the fatigue and the negative effects, the distress will affect you. And not like, if you can see this, I'll take the cursor. Yeah, it's a smooth, slow curve up to this level. But compared to this smooth curve, it's a drastic downhill curve to this side, where you have strain and then crisis, exhaustion, right? So this is the point, the crucial point. We have to be mindful about stress when we cross this level. Otherwise, we all have stress and we manage stress But if we are moving towards, when we are in the yellow area, we should be alert, not to push anymore, which or we will come down and our performance will come to zero. The next important thing is how do we know that we are distressed? Because stress we all experience and it's useful at times, right? This is a negative stress. So how do we know that we are distressed? Well, sometimes we tell other people, we don't use this word distress commonly, but we say, oh my God, I'm so stressed. Things are so stressful for me. Things are not working well, right? So we feel because our functions are not happening like smoothly, right? So our emotions are negative. We can't focus. We can't concentrate. Sometimes our judgment is not very good. We come to wrong conclusions. We take wrong decisions, right? So these are cognitive functions, right? Our cognition will affect. And emotions also, we tend to cry, we tend to get angry. Sometimes we say bad things to other people, right? And physical also, we feel distress. So we can check the physical things. It's easy to check. Even now, if you are seated, you can usually kind of check. There are certain checkpoints. When there's stress, you will feel usually in your temple area, this area. Right? This area, you will see the tightness around eyes. This is an area where that's the thing which causes headaches, right? Because of the muscle tension. And the other area is the jaw area. Right? For relaxation, we use this because we can check and relax these things, right? So head, the temples, the eyes, and the jaw area. You can feel the tightness of the jaw, right? And then the neck and the shoulders. There's another area where you feel the tightness, right? So these are the areas we relax. And the chest, the heaviness of the chest. Sometimes they misinterpret this as a heart attack or something, the heaviness of the chest. So these are the areas where you can check for stress. And there are certain investigations we can do. Sometimes your blood pressure may go up. If you're a person with diabetes, your sugar levels may go up. So other things are there where you can check. And sometimes, though you don't notice, other people will start complaining. Look, you're different now. You used to smile with other people and cooperate with other people. Now you're not the same. You get angry easily. Things like that. You may be your family, maybe your colleagues, friends, right? Team members. Okay. And also, the other way we know is sometimes we go to healthcare professionals and they will tell you, sometimes with high blood pressure or diabetes or metabolic syndrome, sometimes they'll ask, because this is one of the modifiable factors we have to prevent these metabolic diseases or non-communicable diseases. Or if you're into a habit like alcoholism or any substance use, the doctors might ask about the stress levels and advise you. So these are the ways we know how we are having stress. So once we know that we are having stress, what we want to know next is how to handle stress. So as we discussed earlier, if it is a reflex, it happens in a reflex. If we can try to make it a reflective thing, think about it, then it will be much better. We all know we have a lot of demands in day-to-day life. So therefore, always there is a stimulus after stimulus for us. A call, a letter, notice, I mean, all these things are there, deadlines, right? So between these stimulus and our response, there's a little space. As Viktor Frankl, he's a psychiatrist who was taken to a concentration camp during World War II. So he is the one who survived being there. He survived because of his thinking, because he didn't respond as other people. His response was different. So he found this small gap between the stimulus and the response, which is very, very valuable, where you think and decide what to do next. So he has written a few books and he has done speeches about his stay in the concentration camps. It's worth reading. One about logotherapy. So actually to find out this space is very important. And once we know that there's a space, so we know that we have choices. And for the next few slides, I'm going to talk about how to use this little space mindfully. So stresses also, I mean, there are many classifications, but today I thought of dividing it into two as external stressors, the things which come from outside. It's sometimes it's not easy to divide it like that, right? Like deadlines or demands. You know, you must do this before this particular date. And I think as lawyers, you have a lot of demands like that, and there'll be, you know, penalties and things like that if you don't do it. So those are coming from outside. And also day-to-day things happening in the country, in the family, in the world, the prices of oil, this, that, and the other, all these things affect. So one thing we can do is we have to focus on things that we can change. Sometimes we worry about things which we can't change, because worry will make the suffering more and the situation is the same. So therefore we have to be mindful whether if you are thinking about or we are stressed about something, whether we have any control over that particular thing. So if not, maybe it should be handled in a different manner. And also, if we have problems, we should improve our problem solving skills. There are many techniques of solving problems. So we can apply and see, because depending on the situation, depending on the skills you have, how urgent it is, these problems will change. So therefore, the problem solving skills, it's like a game. We can do it and see whether we are successful, or if we are not successful, we can analyze and see why it didn't work that way. And also we can expand our network, like if we have a lot of resources, a lot of people in now, I think College of Physicians also, in this particular program, they are trying to link with other professional organizations, right? So because of that, you know, if you have problems, you will have people to help. You know to whom you should speak. So you are not alone. There's a lot of other people who has knowledge and ability to help us. Then if you perceive something as a big task, making it to small components will help you to achieve gradually and much easily with less effort. So that is also something we can do for these external things. If you want to finish theses, or if you want to write a case series or something like that, a book, it's a big task. But if you can make it one case per month or whatever, break it down, it will be easy. And also, for even for external things, as Professor Lekam was on speech earlier, right? So external stresses can affect our body as well. So therefore, we have to take care of our body. Sleep is very important because that is the time where our body, the repairing process occurs. The good sleep, healthy food, relaxation, and suitable exercise with guidance from a healthcare professional is important. So these are some of the things we can do to handle external stressors well and to reduce our stress levels. Now we'll move into internal stressors. Sometimes it's not the external thing which bothers us. It's our own mind, like thoughts and imaginations and our internal talk or speech. So this philosopher Marcus Aurelius has told that, when we stop comparing ourselves and if we look internally into ourselves, that gives us a good insight where we should move and how these changes should occur in our mind to reduce the stress. So in the next slide, I have mentioned few examples. One is if you feel stressed, just think about it. Why I'm distressed or stressed, whatever. Some people use both, but I'm particularly focusing on distress here, right? So what is bothering me? What is bothering me? Usually when you try to pen it, it will become clear because mentally we can move from one to the other and we can make it more complex. If you sit and write, it will be very clear what is happening to us, what exactly is bothering us. So that will solve half the problem. And also the second thing is the flexibility. Flexibility in the sense psychological flexibility. Sometimes because we are not bad people, we try to maintain our standards and things. So because of these things, we are sometimes harsh on ourselves and harsh on other people as well, because we know what exactly to do and the perfect way to do and the best way to do. And we don't want to accept nothing but the best. So sometimes this doesn't mean that you have to, lower the standards and go for poor quality, accept poor quality work and all that, right? But if you are very rigid and if you are not flexible, it affects us more than the other people. So no one is perfect. We all have our difficult days or difficult times, right? So therefore, just say I had a bad day, but remember, the next time we always try to improve ourselves. Self-improvement is very important, but being a rigid person makes it very, very stressful. And also we can, if there's something stressful happening, we can reframe the problem. And we can look at these things in a different manner, whether there's anything good, whether there's anything beneficial for me in this situation. Right? Now, the COVID-19, affected the whole world. It's a pandemic. And is it all bad? Is there anything good happened due to COVID-19? I think you can think of few things. It's not that bad, right? So, like that, or even looking at a person, right? The first thing is sometimes maybe your colleagues, maybe your family, you get so stressed because sometimes they create problems and a lot of unnecessary things are happening. But then again, anything else or any good or any neutral thing happen due to this? If you think of that, then your stress level will immediately go down. So it's not that easy to do, though I mention it here. It's not easy, but this is a skill we have to practice. Not that, I'm also good at this, but I'm still I'm trying my best to practice to see something good, right? And sometimes we have to accept what we can. Sometimes we have to say no, because a lot of times, we, as even the doctors, we take a lot of tasks, one after the other, from one place to the other place. So the same way, I think you all are also, when people come for help and the family commitments are there and your social life is also there, right? So we have to balance all, managing many things at your hand is not easy. So you say yes to these things and you feel so stressed. How am I going to jump from the next one Zoom meeting to the other, one place to another place, one party and the daughter's prize giving or something like that. So sometimes we have to prioritize things and how to say no without hurting other people. And also you have to tell this message very clearly that it is not possible for me to come for this event or something. So usually we say, okay, I'll come, and the list of things, the to-do list becomes longer and longer. So this is one thing most of professionals get stressed because of this. And also, not everybody, some people do post-mortem. When something happens, then think about it again and again and again. But it's for once you can analyze, but more than that is not useful. So we should tell ourselves, once it is done, if I said something wrong, it's over. I can say sorry about it and then forget about it. Not to go through it again and again. You're re-traumatizing yourselves. So this is also cause a lot of stress in people. And if it comes to your mind again and again, oh, I did this, oh, I did that, this was wrong. Don't be harsh on yourself. If it is really necessary, you can keep a worry time, or, okay, my worry time is from 9 to 10 or 9 to 9:30. So I will write it down and I'll think about it then. Not now, right? So some kind of postpone is necessary. Otherwise, our adrenaline levels and cortisol levels will slowly kill us. And also, it's very important if you have a person to speak to, maybe a friend or a professional. And once you ventilate your thoughts and emotions, it will also help you to reduce your stress. Professional help is there, the counselors and psychologists and psychiatrists, and these are 3 levels we operate. So if you think it's out of your hands. It's not a, some people think it's you're weak if you go and meet these people. No, if you're strong only, you will go and meet these people and get your stress relieved. So these are few things. There are a lot of things. These are few things we can do to reduce internal stress. And also a little bit about the self-talk or the reflection about what we are doing is very important. Not every day, but once in a way, just to check whether I'm happy doing this job, maybe I'm happy this particular circle of friends, right? And is this mandatory, or do I have a choice here? Can I change this? And if it is mandatory, if it is a must, how can I make it more interesting, more enjoyable, right? And if not, if it is not mandatory, would I be happy doing something else? Sometimes we just curse, but still we do the same thing. When there are many doors are open, we never see those opportunities to change. And before taking on another thing or another task or another job or whatever, just you think, what are my strengths? Are they suitable for this? And what are my shortcomings or weaknesses? And what opportunities I will get if I do this? And what obstacles will I meet? So these are very important when you select something. If you select correctly, if your choice is good, your stress is less. Sometimes we do wrong selections. Then we have to suffer. And think whether are we ready to move on to something else, ready for the change. And then you can accept. Even if it is stressful, you can accept and make it enjoyable, and you can change things internally a little bit and move on with that. Or you can change, or you can quit and start something new. So all these are there, options are there. It's up to us to make the correct and the wise choice, where you should combine your emotions and your cognition, right? That you or your brain and the heart together for a better decision, right? So this self-talk is important once in a way, just to find out which direction are we moving. Are we moving towards more stress, distress, burnout, or are we moving away from that? So as we have this inbuilt stress response, can we replace it using a relaxation response? Because we can train, because humans, we can do a lot of things which animals can't do. So shall we use these to reduce the stress? So there are lots of things, but I have listed few here. One is relaxation, physical relaxation, because usually with stress, as I told you earlier, we feel a lot of pain. So the one thing you can do is the progressive muscular relaxation. Tightness gives us pain, and when it is relaxed, you will feel a nice relaxed feeling. So as I told you in the previous slide, check your muscles, the warning signs for stress, and then you can relax them. And for this, you can use this progressive muscular relaxation, where we tighten and then release the muscles, or guided imagery. Even without somebody guiding you, you can visualize things, the happy memories, the happy events, and the relaxed environments, and go into relaxation. And autogenic relaxation is something like meditation, where you scan the body, you go through the body, and you look for pain and other sensations, focus on what is happening and then relax. And certain mindfulness practices to do things mindfully now and here without jumping from one to the other is very helpful, and it's used in almost all the religions and all the communities. So this is very good thing to practice, but initially it will be a little difficult, but start with 1 or 2 minutes, and it will be automatically grow up to a satisfactory level. And if you like, the yoga and meditations are good. Fine arts, music, dancing, painting, those are good things because it will give a lot of positive vibes, and to the stress hormones like adrenaline, cortisols, like so. And same way, there are other hormones like dopamine, which will chemicals which will give nice feelings to us. So these fine arts will make our emotions change and release the good chemicals from our body. And the hobbies you like, bird watching, maybe anything like hiking, it's very good, going into higher levels, and you can free from your ties and release your mind, and travel to various places, having pets, pet dogs, cats, right? Talking to them, gardening, right? And some martial arts, I mean, like Kung Fu, Tai Chi, where you concentrate and do things. And last but not the least, there are certain medications as well. But medications, and I forgot to write, the street drugs also gives some kind of relaxation, but the danger is it's like buy one get one free kind of. You get a good effect, but there are more, not one buy two, buy one get two free kind of. You get psychiatric illnesses and other things if you use drugs like ecstasy and cannabis, alcohol, and those are like, you can temporarily get the effect, but long term it's not good. So the medications like certain the receptor blockers are there, we call them SSRIs and things like that, the medications that can reduce your stress levels. So all these things can be used to promote the relaxation response. So we have to be very mindful when selecting these things, because just because it's there in the book or it's experimented, we have to be very mindful. We have to select one according to our personalities, our skills, and our available time and in one. Now, for instance, meditation is very good, but if you go for a retreat, leaving your children behind for weeks, they all will suffer. So therefore, we have to select mindfully, select something which goes well with your other commitments and the lifestyle. So this is all I have to say. So I would like to go through it again. We started talking about how relaxed or how stressful you are, and the stress response, fight, flight, or freeze. Those are primitive and it occurs automatically, but it's helpful to survive our day-to-day things. But the bad thing is, or the negative thing is, the prolonged stress levels or negative things which change our physical health, cognition, and emotions. So we have to do something about this, because it can affect all these components and make us illnesses. So to handle this, we have to find how to respond, and the little gap between the stimulus and the response, and to fill this gap, we have to identify what kind of stressors we are having. Certain things are external, and for these we can do certain things like selecting our problems to our plate. Like as we are serving from a buffet, we select only what we like or what is relevant for us, what we can change, and problem solving skills to practice and evaluate after each problem solving task or session, and to expand our social network, get help from professionals, and to take big, if you think of big tasks, to break it into small and do it. And the internal things, those are talk inside our mind. Sometimes our enemies, our own thoughts. So to not to fight with them, but to identify and try to change and cultivate more healthy thoughts, not let automatic negative thoughts dominate us. In this therapy called cognitive behavioral therapy, this is what we do. We identify our negative thoughts and we try to replace them with alternative thoughts. So because for this, it's nice for us to write our problems when it becomes a stress, and try to be psychologically flexible and to reframe the problems and look at other sides or the other viewpoints, and accept what we can, and how to say no politely, and try to reduce time reflecting on one thing again and again and again, doing postmortems for something which has already happened. And if it is difficult to have a worry time, and speak to someone about these things and ventilate your emotions, and self-talk once in a way to guide you and your journey to the correct path. If you go through this, you will know how to decide, how to correct. There's no correct or wrong decision, but how to at least the minimal the path with minimal difficulties you can select or to accept change of it. And there are other things we can introduce to ourselves. So though the stressful things are there, as a whole will be bigger and will be much richer at the end, because we have learned a lot of skills through this process. So any stress, it's like a storm. This stressful period is like a storm, but when you come out of it, if you survive it, you're not the same person. You have learned a lot of skills and you'll be a rich person, and you can give something back to the society. So I think this is all I want to share with you. Happy to answer any questions if there are any.
Yes, madam. Thank you very much for the comprehensive lecture on stress. I think it's been, they have a lot of questions because doctors, lawyers, we work a lot and we have a lot of external stressors. So I think it's a very good lecture on how to overcome and how to identify your stressors. So we have a question from one of our viewers today. What part does meditation and exercise play in controlling stress? I think you mentioned about it. If you can elaborate more on meditation and exercise in controlling stress.
Yeah, exercise, of course, now exercise will, now I told earlier, this stress response gives causes increased heart rate and all these things. But you might think exercise also will do the same. Yes, to a certain level, but it's a healthy way, because at the end you get a reward. right? When you lose calories, you feel happy about it. When you walk a mile, you feel happy about it. So to the good things like dopamine and those things will help us to make these adrenaline peaks less in stressful situations. And meditation does something else, that is in the nervous system there are two things like this fight flight things are done by the sympathetic nervous system, right? Which cause this adrenaline surge and all that. So the other system is parasympathetic system, where it will calm down our mind, calm down, right? So this meditation will cause parasympathetic activity. So this activity will cause calming down. And also meditation does certain other things also, like not all, I mean, I'm not an expert in meditation, but especially, I mean, if we the metta meditation or the simple things, and even if you observe your thoughts in mindfulness, you observe your thoughts, so you can see the nature of these thoughts. The thoughts will come, thoughts will stay, and they will move. You don't have to cling to them, right? So just recognize without reacting. So this is the crucial point. It's very difficult, but this is the beauty of meditation or mindfulness, because we can reduce, even though we can't stop reaction, we can reduce our reaction and we can come back to normal. Okay, I'm angry now. That is my statement. I'm angry now. No, I got this thought that I'm angry, and I'm seeing this thought that I'm angry. So it's just a thought. It's not me. It's not attached to me. I can push it away. So this way, if you look at those things, it's like vehicles in the road, and they come, they stop, they go. So these observations occur in meditation will help us not to react. And also this little window period in our mind to do some other thing, some other choice. I don't know whether I explained you well. So the exercise will give good hormones like dopamine and things. The meditation will give parasympathetic stimulation. Both can give a soothing effect towards our adrenaline and cortisol levels and calm us down.
Right.
Okay.
Thank you very much, Madam. Yes, I think we got a good comprehensive answer. And Madam, we have another question, and it's about sleep. How can lack of sleep affect the stress response? Because as the lawyers, they have sent these questions because they usually have 7 days per week work, and also sometimes 4 to 5 hours sleep at night. So lack of sleep, can it affect your stress response?
Yes, because sleep occurs in phases. The beauty about sleep is when the body sleeps, usually mind is up, a watcher is there. When the mind sleeps, body acts as a watcher and it's there. So both mind and body should get enough rest. So the first half of the sleep, or you call it non-REM sleep, where your mind sleeps, the body is up. So that is the phase where we do sleepwalking and sleep talking and these things, right? And the next part, only the REM sleep or the rapid eye movement sleep, where we get a rest for the body. And this cycle changes and we see dreams and sometimes nightmares. So to this complete cycle is necessary to get enough rest and time to repair the body and refresh the mind, right? The memory also. For the students, we say if you study and after that, if you sleep, the memory pathways get activated, right? We call this the limbic system in science, right? So this works. So when we get very small amount of sleep, even sometimes the whole day you're up and work till late, and little by little our body and our mind both find it very difficult to, the first thing mind is difficult to focus and concentrate. You will forget things. You're not there. So concentration, judgment, those things affect. So therefore, sleep is necessary, and the body also, you will have lot of body aches and pains, and fitness will go down. So therefore, sleep is very important. And when you can't do your tasks as if you did in the past, so then naturally you get stressed up when others point out, you did this wrong and this is not the way to do and all this. So it goes like a vicious cycle, right? And so one way is to improve your sleep and manage the time. If the time management is good, you can sleep and get few naps if really necessary, right? Limit it to maximum 30 minutes, not 2-3 hours during the daytime. So that will help. So I think it's very important to have a good sleep, restful sleep, to get a fresh start in the following day, and in long term to reduce stress.
As you mentioned about this impact of stress, are there any signs or symptoms that they can identify that they are having some bad effects due to stress, especially as they if they are having stress, lot of stressors, and if they have problems? Are there any signs and symptoms that they can identify and they need to get medical advice?
Yeah, I'm not sure about the medical advice, but still, if you forget things very frequently, and if you can't concentrate on certain things, and if you if you do wrong judgment or wrong decisions, usually it's not the thing. But if you think the things are not going properly, and if you shout at other people very frequently, and if the people are trying to go away from you, they are not very happy to be in your company, then one person might not like you. That's natural, but you feel that people are moving away from you. So those are the emotional things, and also you feel like crying, or you feel like why I'm here, what's the point of doing all these things. A lot of negative thoughts are coming to your mind, and aches and pains, and the energy level drops. Drops a lot when we are under stress, right? And eating habits. If you usually the young people, not like older people, they tend to eat more, not very healthy food, junk food, right? And if you're getting this habit of eating this junk food very frequently, and if you feel like having more alcohol, smoking, and those things, those are signs where you're having you are moving towards distress, not the good stress or the helpful thing. But negative things are happening if you are moving towards those. So be mindful.
We have another question. How to avoid burnout? So I think we spoke about it, but if you can just summarize how to avoid burnout.
The thing is, now if we are mindful, when the stressors are there, and we have to know that I don't know whether you were there. I show a graph, the yellow. I mean, when you are stretching yourself, දැන් නම් ටිකක් බෑ වගේ කියලා. ඒක තා චුට්ටක් දැන් ඇදිලා තියෙන්නේ කියන එක you feel it. And at that point you have to do something, otherwise you will go towards burnout where you can't do anything. Then you need professional help actually if you go to that level. But before that you can try all these things I have mentioned before. So sometimes we need to change, and sometimes at that point the system also we have to discuss with the authorities and people and environment, the family and other things also. It's not sometimes the particular person, because that person need lot of help when you go to that level. So the best prevention is to be mindful, right? Once in a way have a reflection or self-talk about where am I? Am I throughout my 24 hours before sleep even, if you can check how was my day, how stressful or how relaxed it is. So where can I include just 2 minutes is a good start, right? Have I just checked these 4 before you sleep? My work or the job, am I satisfied with my job? Whether I have done it well, whether I'm happy with it. Secondly, what about my relationships with the family, relationship with the colleagues, clients and other people, right? Is it good? And then, have I done anything for my physical health? To at least walking or climbing up a staircase, something simple like that. Have I done at least one thing today? And then for my food for mind, right? Creativity, at least to listen to a song very well focused, right? Sometimes we listen to songs but we don't focus on them, so that won't give you relaxation, right? Or creative thing, anything, right? Painting or anything, gardening, something, right? So these 4 pillars are very important to a life, because if any of these pillars, sometimes we work a lot, we do perfect work, we go to courts and everyone knows that, you know, I have established everything. But sometimes my relationships with the family and other people might suffer because of that. Or my physical health suffer because I don't have time. So try to balance this. If you can balance this, you can prevent moving towards burnout. That is another thing we can do and check every night. And I think it's beneficial.
Are there any group activities that they can do, madam? Because they can, apart from individual methods, any group activities, especially because as we are addressing this by association, so if they can organize some specialized activities, are there any activities that you can recommend? Because you're the best person to answer this, because you are also a multi-talented doctor. So I would like to ask this question from you.
Yeah, there are a lot of things that we can do together, and that group, that sense of belonging also helps us a lot. And we can organize a lot of sports events, the matches, volleyball, cricket, and I mean, all these matches you can organize. I know this law medical cricket match is there, but I don't know about, there are a lot of other sports, right? There are a lot of people can involve in these things and organize those things as group activities, and also singing together, because you when you sing together, we try to go as one voice. We don't try to, you know, overpower other voices. So that is a very nice thing to build up a nice group. Singing activities and drumming also. And there are a lot of even if you don't know anything about music, right? If you can make some music, like beats, like something like that, it gives a different sound. body parts, right? And it's like a game you can do, and music making is good for everybody, and singing nice songs, old songs, and which will take us back to the school days or our young days, which gives us pleasant feelings, and we'll be rewarded by the happiness hormones, right? Singing, dancing activities, all those things are very good. And sometimes certain tasks to help other people, like giving your time and energy to betterment of the society, the social responsibility, all these things will create a good team spirit and reduce your stress. And also you see the world, like we sometimes we know only the people surrounded by us, but what about the rest of the world? How other people think, how different cultures, how they do things, right? And also the New Year and other religious celebrations we can do. So I think a lot of activities are there, and we can make them annual events or ad hoc things time to time.
Thank you very much, madam. Before we conclude, I would like to ask one more question, last question. Are there any help groups or any professional bodies to help if there are any serious complications related to stress?
Yes, I mean, there are the NIMH, they have this hotline, and also Sri Lanka, the Sumitra, and there are other NGOs are there, and also individually in Sri Lanka, you can meet any counselor, psychologist, or a psychiatrist if you have a problem. And as a College of Psychiatrists also, there are people, even during the COVID, they did a lot for this. Not only for professionals, everybody. I think in future also we can inter-college self-help groups and things like that. We can create more, and that will be very beneficial. So if there's any issue, I think it's better to talk and ask and get proper help, because we can save a lot of quality time from our life if we get help, and don't think it's a weakness, right? Only very courageous people can go and tell that I need help and get proper help, and help is available. Please contact our college or personally any of us. Help is there. I'm sure psychologists also, they have a association and a college, I think now. Yeah, they all are there to help you if there's a problem.
Thank you very much, madam, for the excellent lecture and the discussion. Dr. Harshini Rajapaksha, Senior Lecturer in Psychiatry, Faculty of Medicine, University of Ruhuna, and she's also a consultant psychiatrist specialized in liaison psychiatry in Teaching Hospital, Karapitia. So we have come to an end of very useful webinar series conducted by the Ceylon College of Physicians in collaboration with Bar Association of Sri Lanka. In keeping with our theme for year 2022, Bridging Gaps and Crossing Divides, this became a successful effort to make ties with other professional organizations. I would like to thank the Bar Association of Sri Lanka for the tremendous effort on organizing the webinar series in collaboration with Ceylon College of Physicians. And I would like to extend my sincere gratitude to Mrs. Salia Piris, President Council, President, Bar Association of Sri Lanka, Mr. Rajiv Amrasuriya, Attorney at Law, Secretary, Bar Association of Sri Lanka, Professor Arosha Disanayaka, President, Ceylon College of Physicians, to their guidance and support throughout, and especially to Miss Anne Devananda to coordinate. She is the one who coordinated all these webinars throughout, and thank you very much, Anne, for your kind support. Next, I would like to thank our speakers for today, Professor Sarath Lekambasam, former Dean, Faculty of Medicine, University of Ruhuna, past President, Ceylon College of Physicians, and Chair Professor, Faculty of Medicine, University of Ruhuna, for the excellent speech on osteoporosis, and Dr. Harshini Rajapaksha, Senior Lecturer in Psychiatry and Consultant Psychiatry, specialized in Liaison Psychiatry at Faculty of Medicine, University of Ruhuna, for the excellent speech on stress management. Finally, I thank all the participants for your active participation. Hope we can meet you all soon, and we would have more lectures in collaboration with Ceylon College of Physicians. Over to you, Malik. Thank you so much.
Thank you, Dr. Kannangara. Ladies and gentlemen, today's session was the third webinar in collaboration with the Ceylon College of Physicians, and on behalf of the Bar Association of Sri Lanka, I would like to thank Professor Arosha Disanayaka, President of the Ceylon College of Physicians, and for extending their cooperation and resources to deliver 3 valuable health-related webinars to our membership. And I would also like to thank Professor Sarath Lekambasam and Dr. Harshini Rajapaksha for taking this time to deliver today's informative and valuable session. And also, I would like to extend my sincere gratitude to Dr. Lushanthi Kannangara, who moderated not only this session, but also last 2 sessions as well, making each webinar a colorful one. Finally, I'd like to thank those of who have joined through Zoom and on YouTube. And thank you all. See you next time. Good night.
Thank you.